Hi, good afternoon. It's Tawni Peterson, nurse practitioner from Adams County Health Center. Today we are going to be discussing masks, and this came at a perfect time just because all of the information now that is going around about masks. So the CDC is recommending that everyone now wear a mask when they're in a public setting. A public setting might be like the grocery store or going to the pharmacy or going to the post office. If you're in your own home, unless you're sick or someone else is sick, you don't necessarily have to wear a mask. And keep in mind that wearing a mask does not negate social distancing. It's going to take a combination of a lot of things that help us to dampen the coronavirus. So wearing a mask in public situations is just one more method to slowing the spread of COVID. So what I'm going to do today is I'm not going to give a demonstration on making a mask, and I'm not going to make like hard and fast recommendations on what type of material you should be using and all of that, but I do want to at least give you information that can be very useful, and I'm going to provide links once I'm done with this live feed that you can follow and you can educate yourself. The links, I spent a lot of time going through a lot of different resources, and I wanted them to be user-friendly. I wanted the information to be truthful, and I wanted to provide like a broad range of information regarding this topic. A couple things that I can tell you though is that if you're choosing to sew your mask at home or do one of the masks that don't require sewing, there are just a few hard and fast rules that I found to be very beneficial, and that is that you do want to use a woven fabric. You do not want to use a knit fabric or a fabric that a light can shine through. And then you do want to choose a fabric for its breathability. You want to make sure that the mask that you're wearing you can actually breathe in, so that when you go out to the post office or the grocery store, you're going to be able to keep it on. It's going to be comfortable enough that you're going to actually be able to keep it in place. There's a couple other things. Let's see. Oh yes, okay, so when you have worn your mask, if it becomes damp from just breathing in and out, you want to make sure that that mask now either gets washed or disinfected, because you don't want to harbor a virus. When you're washing your masks, you can wash your masks in your washing machine with warm soapy water, and then you can dry it. Data is still out on how many times you can actually wash a mask, and so hopefully that information will be coming soon. What I personally like to do is I have 3 masks, and I have hooks in my garage, and I rotate these masks. So here would be an example. Here's my mask. I take it off and I go hang it in the garage, and it's going to sit away from other masks, away from other things, and it's just going to have 3 days to decontaminate. And so I switch those masks in and out. You also want to remember that when you're wearing these masks are not to protect you from people that have the virus. These masks are to protect others from you. And like they've said, many of us are actually asymptomatic. We don't know that we have the virus. And so maybe one of us will be going to the grocery store or the post office or the pharmacy carrying this virus. We're not sick, we don't feel sick, and we would never want to infect someone, but we don't realize that we could be asymptomatic and actually spreading that virus. And so by wearing these masks, we're protecting others around us. And once again, I always want to keep saying that doesn't mean that we don't need to be social distancing. We don't want to think that these masks are going to take place of that. But it is just a really good way for us to participate in not spreading the virus. So before you ever put a mask on, you always want to make sure that you wash your hands with soapy water, or you use a hand sanitizer, because you don't want to contaminate your mask before you even put it on. This mask here, of course, we wouldn't be able to get our hands on right now. Rio brought these from Denver when he came home. But I will tell you a little funny side story, and that is 2 weeks ago, I decided, geez, maybe I should get some masks. And so I went onto eBay and I looked at the seller, and they had a 95% rating, and I felt real confident about buying from them, and so I ordered 20 masks. And sure enough, within about 30 minutes, I got an email from eBay saying that it was a scam and that my money had been stolen and I needed to get a hold of PayPal. So I don't know, that was just a really good lesson for me. I do tend to internet shop, and I personally have had very few problems, but I definitely won't do that again. So do know that, as we know, the N95s are just not available and the surgical masks are not available. And that's why we're now either purchasing from someone that is local or that we can trust, or making our own. So this mask here, it happens to have the top loop and the bottom loop. So I've washed my hands, or I've disinfected them. I'm holding the mask by the loops. I don't want to touch all over this mask because I don't want to contaminate it. So I would start by making sure it's going the right direction. A lot of people are sewing fabric on the inside that is a different color from the outside, so they know which side goes towards the face. And you want to make sure that it is going the right direction, like is it going towards your nose and your chin. So with this mask, I would place it against my nose and my chin, and I'm going to take the top loop and put it on first, and then I'm going to take the bottom loop, excuse me, and put it on second. I'm trying to do this and talk loud enough. When I go to remove it, I'm going to take the bottom loop, and then I would take the top loop. That wasn't that easy demonstrating. One of the things that I don't want to do when I take it off, you take it off in a very smooth, slow method, and then you don't want to shake it. You don't want to shake it or, you know, move it all around. You just very gently then go toss it in the washer, or in this case, this normally would be disposed of, but because we are so short on masks right now, we're not doing that. So this mask now would get hung into the garage for 3 days. If this was the type of mask that fit this direction, which I know it doesn't, I would go over one ear and then over another ear, be like this, and then I would take it off and I would take it off. Again, holding it in a very steady state. A couple things that I have even seen people do, and that is they have their mask on and then they pull their mask way down to talk, or they wear their mask below their nose so that they can breathe, or they pull their mask down to their chin so they can talk. So keep in mind that that mask is now contaminated. Once you remove your mask, again, you want to wash your hands or disinfect them. If you have more than yourself in the household, then you want to label your mask. You want to label your mask. Some people keep their mask in brown paper bags. If that's the case, you want to label that bag. I have seen so many things on the internet, like this is the way you can disinfect, this is the way you can clean them. And personally, I would just stick with throwing it in the wash machine with warm or hot soapy water and drying it, or hanging it for 3 days away from anything else to disinfect it. So let's see where we're at. A couple rules about wearing a mask is you would never want to put a mask on a child that's under 2 years old. You would never want to put a mask on someone that is unable to take it off themselves, including somebody that is not conscious. So you'd never want to put a mask on those people. Let's see. I think that pretty well sums that up. The other thing is, if you're a contact wearer, this would be a really good time to switch to glasses, because your glasses will give your eyes some protection. Remember, your eyes are a mucous membrane. Also, it keeps your hands out of your eyes. So this is just a great time to move into glasses if you do wear contacts. A couple of the links that I'm going to provide today, I'll go ahead and tell you them. One is by the CDC, and it's using a cloth face covering to slow the spread of COVID. One of them is information covering all masks, questions, statistics, and how to. There's another link on taking masks on and off. There's so many different masks right now that are being sewn and made that if I went through every single way of taking a mask off, it would just take too long. There's a really great link on tested material for mask making. And then I'm going to give you a link to someone local that makes masks, Satin Serenity. They're located in Garden Valley. I'm not affiliated with them. When I was in the spa industry, I used to buy a lot of linens and robes and things from them, so I love their quality and I trust them. But I'll give you their link. Their masks are kind of cool. They are double layered, and then they do have the ability to slip material inside. This material does filter viruses and bacteria. It's not as breathable when you have that material slipped inside, so that's why they've made it so you can take that in and out. If you were just running to town, I wouldn't recommend that you have that in, only because you're using this just to protect others from you, and you want to be able to breathe in it and go around town. But if you were sick or you were taking care of somebody that was sick, then I think it would be important to have that material slipped into that fabric. So on Thursday, I'm going to give a list of resources that might be useful for people in need. And these resources might include people that are struggling financially. Maybe they need food, maybe medical, spiritual, counseling. There's so many resources out there, and I'm always being updated through my emails, and I thought this would be a really good time to get that information out to people who may need them. So if you have any questions today regarding masks, just leave the question in the comments, and I will get back to you. And otherwise, I will see you on Thursday. Thank you.